So this first movement is just this sweeping out from the spine across the shoulders. It's a very gentle move. It is a warm-up move. And the only difference really with what we normally do is we might normally come up and down, we might normally come in and out, but here we're just starting at the spine and we're sweeping out. You can either use the flat of your thumb, you can use your whole hand, you can use the side of your hand. But the emphasis really is that you're just sweeping outwards from the spine. You can see I'm not putting any great pressure on there because we've got potential muscle damage, so we don't want to put any pressure on that. So just a nice, simple one to start with, just an amendment of an adaptation of what we usually do. So this rocking of the head movement that we referred to, it's really just to start to introduce some very, very gentle movement. You can see it's no more than Daniel would do if he was driving and turning his head. It's a lot less, in fact, than if he was looking over his shoulder to turn round. But we do this for a minute or two. So you can see I'm supporting the head. I'm making sure I take the weight of the head. And we're just very gently rocking backwards and forwards. So this is when we're moving into phase 2 of the frozen shoulder, and we want to start working into the pecs, but we're still working very gentle. So you can see with the flat of my knuckles, I'm using 3 fingers and I'm just putting pressure on. There's much deeper moves that we'll do with other topics where we'll mobilise the arm as well, but we're not going to do that here. We just want to start to kind of really wake the pecs up a bit and check that there's nothing in there that's holding it. Now this is where with ladies you can't work as low because you'd be meeting breast tissue here and you should never massage onto the breast tissue. But where I'm feeling any tightness, I'm just holding that pressure a little bit longer. And you can see I'm not gliding, I'm not using any oil here, I'm not sliding across the muscles. As I come off, I'm coming right off, moving along a bit, and then going back on. I'll show you at the top as well. So it's just that pressure down. My depth is light to medium. For other treatments, we deepen this much more by having the shoulder hanging off the table, which really kind of brings the pecs up so we can work on them. But we can't do that with a frozen shoulder, so we need to be very gentle. And you're just working your way across both sides. You don't need to work in any particular order. I'll tend to do one side and then the other just because it's a bit nicer for the client because they know where you're up to. So I feel a little bit of resistance there. I'm just holding it. I know Daniel's been doing some physical work on moving gravel, so these will have taken a bit of a pounding there. So we'll just release that very, very gently. You can come back over the same areas. If an area feels fine, you don't need to spend a lot of time on it. It's when you can then feel that tension kind of back at you. And it's when you feel resistance in the muscle. So you press down and it's like the muscle's pressing back up at you. That's where you've got tension in the muscle. And for Daniel, it's just here. Once it starts to move, you can then move further down. And once you start to meet up with ribs, you need to just go more gently so that you're not pressing down onto the bone. So because this is the tight area, I'm just again returning here. So no movement across the muscle. We're not gliding across the muscle at all. It is a static press and hold. We're also then going to work the deltoid with the flat of one finger or the flat of your thumb, and we're going to work the anterior, the lateral and the posterior deltoid. Again, we're not using oil, we're not sliding across because of the damage from the frozen shoulder. So we're just pressing and holding. I usually use my finger, but I'm just showing you with my thumb because it's a bit easier, so that I'm not in the way of the camera while I'm doing this. Again, my pressure is medium. I'm not putting a huge amount of pressure on, but because it's phase 2, we can work deeper than we could earlier when we were just doing the very gentle sweep across the shoulders and the head rock. This phase 2 work takes it a little bit deeper. As you get to the edge of the deltoid and you'll feel it, it will start to then come in. So you've got this kind of shape on the muscle. So then we're moving into the middle. Don't worry about which bit of the muscle you're working on. It doesn't matter if you're working partly anterior and partly lateral. You're still working the deltoid, which is the main thing. In terms of contraindications, extra things for this, if somebody's just had an injection, intramuscular injection tends to go into the deltoid, so then you would just need to avoid the area around the injection site. You don't want to risk introducing any infection, and if there's some kind of vaccine that's just been put in, the arm gets sore from a local reaction, a localized reaction. What you don't want to do is to extend that localized reaction by then massaging it. So I'm just going to cross hands. Change hands as I come to the posterior deltoid. Just again for ease of camera. And you can repeat this as many times as you want. I'm demonstrating it fairly quickly here. I might sometimes hold each one. Where I feel resistance, I might hold each point for 30 seconds. If it's really tight, I'll hold it for a minute. For some people, this will be incredibly, incredibly sensitive. More for women than men, generally, I find. I'm not sure of the scientific reason behind that, but just anecdotally, women tend to have more painful upper arms than men do. But that might just be something peculiar to my practice. You'll know that yourself from your own. So you can use your thumb, you can use your finger. You could, if you wanted, cover the two areas together. So you're working anterior and lateral. And then you could work posterior and lateral together. It should feel like a nice relief for the client. It seems strange, it seems like you're not really doing much, but because you're just applying this static pressure to the muscle, you're just encouraging it to relax. But we're not working with any friction on the muscle. We're not going up and down the muscle, kind of moving across it because of that inflammation in this area. So in phase 3, we can get in and we can work into the rotator cuff itself. Remember, working on a whole host of muscles here. I am going to now use some oil, but I'm still going to use that static pressure. But instead of static pressure release, static pressure release, static pressure release, I'm using static pressure and slide, and static pressure and slide. I want to work all around this area. And again, it's when you feel areas of tension, when you feel that resistance to your thumb, as we have there, that's where we're going to use that static pressure. And you can see that little bounce in the muscle there. It's almost kind of pinging under my thumb. So that's where we want to apply that static pressure. If I was stood in my normal position, I would probably use my thumb for this, but again, just so that you can see it properly on camera, I'm using the tips of the fingers, but together, so they kind of form one flat surface. And I can feel that muscle again moving under my fingers as it starts to release. I need to make sure I work it all, so I'm just going to adjust my position very, very slightly. Again, you need really short nails for this, otherwise you're going to be digging nails in. I think maybe static pressure is one of the things in massage that's generally underutilised. We tend to like to get into a flow of our work, but actually static pressure is really good in releasing. And sometimes if it won't release, then static pressure, hold it for 20-30 seconds, release it, allow the blood flow back in, and then static pressure again can be really effective. And again, I can feel that muscle just sliding out under my fingers as it releases. And again, you can repeat this work, you can keep coming back to it. Remember, we're encouraging an area that's been frozen now to start moving. So some of these muscles will have become shortened. If anybody does any desk work, or if they're kind of curled up over their computer or over their phone, these muscles tend to shorten. And so this static pressure is really good. So even if your client hasn't got a frozen shoulder, but they're maybe in an office job and they're crouched over their computer for 40 hours a week, this can be a really effective technique to allow the shoulders to come back. If it feels like the shoulders won't come back from the back work, then it's been held here. So again, it's that static pressure, release, back in. But you can see in between I'm kind of sweeping round as I'm feeling it. So it's just a different move to the press and release. That feels particularly tight in there. And then we need to do the same, but from the back. So I'm going to ask Daniel to turn over so that we can show the back. We're also then in phase 3 going to work the back of the shoulder, and we can work this whole area. Try not to neglect any particular area. And again, you can see it's that slide, hold. Good 20-30 seconds, a minute if you need to. Release, slide, hold. And again, we tend to work more quickly over these areas, but there are some really tender spots here, and it's those tender spots that we need to be aiming for. So this isn't going to be a particularly relaxing treatment for your client, but that's not the intention of it. The intention is to get the shoulder moving. Now, often I would ask my client for feedback on depth. I've worked with Daniel for probably 12 years now, so I don't really need to ask for that depth. But if it's a new client, I would be asking in. And also when I hit a really tender spot, I'm just noticing that his feet move and his feet tend to lift up when I hit a tender spot. So I know that that's a tender spot. And you know yourself, you'll have some clients who are very quiet on the table and some who are very vocal on the table. Some you have to ask for depth, and some will automatically tell you, either verbally or just by their body language. So you can see there, I can feel the tension. I'm kind of spiraling around for where is the middle of it. And it's just there. It's kind of like pea size. So the whole area feels tight, but as you spiral around it, the kind of center of that tension becomes obvious. And that's what I'm holding there. And you can see I'm using one finger, but I'm protecting my own knuckle with having the other finger on top. can feel here it's bigger muscle area, so I'm feeling it with my thumb, and I can feel that crunch under my shoulder, under my thumb, as that muscle starts to move. So the crunching is generally a good thing. If it starts out absolutely solid and then it starts to crunch, we know we've got some movement in there. And don't neglect around here, this can be incredibly tender. Again, particularly with ladies, particularly with larger breasted ladies, because this is all part of the support mechanism for the breast. So you'll find that in larger breasted ladies, this will be a very tender area. But also anybody who's been doing any manual work or who has been sat hunched forward on their computer. We see it a lot in teenagers who are carrying lots of school books, then coming home and doing homework, and then spending their leisure time on their phone or on their tablet. So their arms are just forward the whole time, kind of beginning of the day till the end of the day. And so you'll often find some really tender spots here, particularly in girls as they're going through puberty and they might be self-conscious of developing bodies and sort of hunch forward to try and cover that. And also in particularly tall people, tall adolescents in particular, who are conscious of their height. I can do the same with my thumb, coming up at the top of the deltoids and just picking up any extra tension in there. So you can see it's quite a slow part of the treatment. It's not something that you're going to rush. It's only something you're going to do in phase 3. In phase 1, this would cause more inflammation, so we don't want to do that. But in phase 3, we need to start releasing it and to speeding up that process. Remember, this thawing, this kind of final phase can take up to 3 years. So if by treating it we can get that down to 6 months, that's a huge improvement. And then I'll use the bigger movements afterwards just to check. So my thumb is doing the diagnosing here. Where can I feel tension? And you'll know yourself, the more you work, the more kind of sensitive your thumbs, your hands, your elbows even become to finding tension. So clients will say, how do you know it hurts there? That's where it hurts. And it's like, because your body's telling me that's where the muscle tension is. So this work that we do in phase 2 and phase 3 of frozen shoulder is the work that we also do with rotator cuff. So if you've been watching this section as part of the rotator cuff work, it is the same work, even though I'm referring to frozen shoulder. We're still working on the same area. Just be gentle as you work, avoid any areas that are inflamed, and obviously check the cause of the problem first, as we've already discussed.